So for renal cell carcinoma, PET-CT has not been widely used to date. This is a little bit perhaps like prostate cancer 10 years ago, before PSMA PET-CT, where PET just was not used very much in prostate cancer, but we are seeing a lot of rapid changes and a lot of new radiotracers that can potentially improve the outcomes of patients with renal cell cancer. So PSMA, used in prostate cancer, interestingly also has quite high uptake in renal cell cancer, and we've published a few papers on this, and we image quite a few patients actually with PSMA PET-CT. But the expression of PSMA is not on the cell surface of renal cell cancer, but in the neovascular, which is the surrounding vessels, and it tends to wash out over time and tends to be quite variable. So an interesting tracer. Recently there's a paper published on FAPI, Fibroblast activating protein in renal cell cancer. This has a very low background activity, so another tracer. And at ASCO GU presented last year were the results of the ZIRCON trial, which is a antibody targeting CA9 labelled to zirconium-89, which has seen a very large Phase III trial with positive results. So coming back to where I started with this small molecule, this is targeting the same cell surface receptor as zircon does, but it's a small molecule rather than an antibody. So with the zirconium-89, you inject the radiotracer, image it several days later. This creates a little bit of a challenge with time for the patient. This is much more convenient using a small molecule, and similar to when we changed from antibodies targeting PSMA to small molecules, it does look like we have much higher tumour uptake, much lower background uptake, and looks like it may be a better approach.